I'm going to show you how guided biofilm therapy, or GBT, works when we professionally clean a patient's mouth from start to finish. My job as a dental hygienist is to detect and treat, but most importantly, prevent periodontal disease. Biofilms are highly organised, microscopic communities of bacteria, but it's responsible for bleeding gums, for bad breath, for some dental infections, for some of the unsightly deposits that we see on our teeth, and of course it's linked to some more serious systemic diseases as well. So here we can see plaque and calculus deposits, but more concerning is the colour of the gums, which are red, and they're also puffy and swollen, that would lead us to believe either gingivitis or even periodontal disease could be present here. One of the problems with biofilm is that you can't see it and you can't feel it. So I use a dye called Biofilm Disclosure, which is an organic coloured dye. So when the dye is applied to the teeth, which have biofilm on them, it changes the colour of the biofilm. It's a really clever two-tone dye, so it means that it stains early biofilm, which is less than 3 days old, pink, and it stains mature biofilm, which is more than 3 days old, blue. The patient is shown in the mirror the stained biofilm. Biofilms are microscopic, whereas the plaque is a biofilm that's matured and it's large enough to be seen with the naked eye. Ideally, what we want is to disrupt dental biofilm before it has the chance to mature into plaque. So this is where we start the cleaning process, and it is completely different to the old-fashioned methods of curettage and hand scaling. So here I'm using a tool called Airflow Max, which acts like a warm jet wash for inside the mouth. It uses a combination of warm water and tiny soluble and antimicrobial powder. Airflow Max will remove 100% of the biofilm from the teeth and all of the surrounding tissues, including underneath the gums where it's dark and warm and the biofilm really likes to hide. I'm also using the Airflow Max not just to take the biofilm away, but it takes the stains away as well. So the mouth looks and feels super clean afterwards. It's very comfortable for the patient. It's gentle, it's efficient, it's very safe, with no abrasion or damage to the tooth surface at all. After we've disrupted all of the biofilm and we've removed all of the stains, PAs on no pain is used at this stage, and it uses ultrasonic vibrations to remove any remaining hard calculus. It shaves the calculus off very gently. So it's very different to the old-fashioned methods of scraping the teeth, which would take calculus away, but would also scratch the tooth surface. Stage 7 of the GBT process is our quality control stage, really. So here I would spend a few moments checking around the whole mouth to ensure that all the deposits have been removed and all the biofilms being disrupted. So at this stage I would hand the mirror back to my patient so they can see the before and after results of their guided biofilm therapy treatment. I usually ask my patients to run their tongue over the teeth at this stage to feel how silky smooth they are now that the biofilm and calculus has gone. Learning good oral hygiene habits is like learning to swim. You have to be shown. So ask your dental hygienist to teach you how to clean your teeth properly. Spend the most time and concentrate the most efforts on the areas that you can't see. That's where you'll find the most biofilm. So in between the back teeth, underneath the gum line, around the base of restorations. Oh, I love my job. I love it so much. Because I get to put smiles on people's